Declining COVID cases and fewer hospitalizations, patients and providers say care is still being compromised at the Valley's top trauma center. Hello and thanks for joining us live at 7. I'm Dave Courvoisier.
And I'm Tricia Keene. 13 Chief Investigator Darcy Spears has an exclusive inside look at a UMC patient care area that nurses refer to as the dungeon.
No privacy, no rest, lights on around the clock. Multiple patients grouped together in a zippered plastic tent in a hospital hallway.
Nobody should ever be treated that way.
Our own governor.
Well, healthcare in our state is good. It needs to get a lot better.
Thinks overcrowding is a thing of the past, left behind after the height of the pandemic.
We were short of beds. We were putting people in hallways in different areas, and that's all back to normal now, and people get their standard healthcare.
Not quite.
Well, late at night, I experienced chest pain. It was very throbbing.
You may recognize Kevin Child as a former school board trustee, but on March 8th, he was just another patient needing urgent medical care.
So I went on WebMD, looked up the symptoms, and it said possible heart attack. So I got myself prepared and went to the emergency room at UMC.
Child says he was quickly triaged and hooked up to a heart monitor, but after that, his care ground to a halt.
They put me in a hall for almost 17 hours.
A hallway.
A hallway. I'm afraid of my heart. I got a cardiovascular problem, and now I'm like going, if something happens, I don't want to die.
Patients are not getting appropriate care if they are in a hallway in a chair somewhere.
Erica is a former UMC nurse who asked us not to use her last name. She worked at the hospital for 9 years, but left right before the pandemic hit.
Does it surprise you, having worked at UMC, to see stuff like that?
No, not at all.
Another patient who went to UMC with chest pain at the end of March emailed 13 Investigates with a similar story. Her family says she was kept in a chair in UMC's emergency department hallway for about 35 hours without access to food, her regular medication, or a way to contact family.
I felt alone.
When Kevin Child's long wait finally ended, he was transferred to a bed, but not in a regular room.
It was tented off with plastic with a zipper for a doorway, and they had 9 beds in that room, and they co-edited it.
You would not normally ever put male and female together in the same room like that. That's unusual.
Kevin's photos and cell phone videos document images reminiscent of a mobile Army surgical hospital.
I felt like I was in the 4077 MASH unit.
Another nurse who was working at UMC when Kevin was there spoke to us on background, fearing backlash if she went on camera. She called the plastic tent a terrible way to keep patients, describing it as inhumane, unsanitary, and not properly supplied in case of emergency.
She says patients were housed here for days without call buttons, televisions, or running water, sometimes having to use portable toilets some other patients could see and all could hear.
And this area that we were in wasn't really climate controlled. It was very warm. The lights were on all night long, all day long. And I figured if somebody got COVID in that room, it was going to bounce around pretty heavily and we were all going to get sick.
Kevin's pictures show duct tape beginning to detach from the ceiling where it's holding up plastic sheet walls.
If they were trying to kind of quarantine anything, that would not have been effective. It was haphazard.
Kevin says sleep was impossible, and despite some mobile screens, privacy was nearly non-existent. In one of his videos,
do you have any pain right now?
You could hear nurses doing neuro exams in the background. I don't know a single nurse that would be happy or comfortable with that.
UMC did not provide an on-camera interview, but sent a statement explaining that the hospital was experiencing a domino effect from patients who delayed care during the height of COVID. A spokesperson wrote, "To ensure every patient received the vital healthcare services they needed, we temporarily opened several surge units to increase UMC's bed capacity. While some of these units lacked amenities, such as televisions for each patient and comfortable recliners for visitors, all of these areas were climate controlled and provided the highest level of care for patients, regardless of their location within the hospital."
I would ask if they were over their bed capacity, why they didn't go temporarily on divert status until they could accommodate all of those patients appropriately.
We asked, and UMC said all local hospitals were at high capacity during this time, and hospitals cannot turn away walk-in traffic. Kevin Child hopes some of the $6.7 billion Nevada received in federal COVID relief funds can be spent on increasing capacity at our county hospital.
We went through this pandemic, and it hurt a lot of people. But we want to make sure that when somebody goes through their door, they have a bed.
UMC says over the past few weeks, with patient volumes returning to normal levels, all surge areas have closed and ER hold times have substantially improved. You can find the hospital's full statement with this story at ktnv.com. Darcy Spears, 13 Investigates.